Hello everyone, the NodeMedic here. In this video, let us talk about the causes of infertility in a female partner. Now, causes of infertility can be local, as in the genital tract of the female, or it can be due to certain systemic illnesses. So, infertility can be local or it can be systemic. In this video, we will talk about the local causes of infertility. That means the causes of infertility which are present in the genital tract of. Now we will talk about infertility starting from the ovary all the way down to the vagina, right? So let's start from the ovary itself. Now in the ovary, there can be anovulation or oligovulation. That means there's less amount of ovulation. That is anovulation, oligovulation, right? Or there can be decreased reserve in the ovary, that means decreased number of follicles, decreased ovarian reserve, right? Then there can be something known as a luteal phase defect. That means something goes wrong in the luteal phase which causes infertility. So that is luteal phase defect. That also affect the endometrium as well. Right. Finally, there can be something known as a luteinized unruptured ovum or trapped ovum. So the ovum do not get a chance to come out and ovulate, but the follicle becomes luteinized. So this is a trapped ovum. So these are mostly the problems of ovary. Now from ovary, we move to the tube, that is fallopian tube. Now in fallopian tube, there can be adhesions, as you can see over here. Now adhesions can be secondary to pelvic infections, some pelvic infections, or any other problems in the peritoneum which can cause adhesions of the tube. There can be previous tubal surgeries which can block the passageway in the tube. Then there can be something known as salpingitis. That is inflammation of the tube which can cause swelling of the walls of the tube and can cause narrowing of the tube. Then there can be retained debris in the tube, retained mucus debris. Then there can be spasm of the tube, or there can be a polyp in the tube. So all these cases, salpingitis, retained mucus debris, tubal spasm, tubal polyp, cause narrowing of the passageway of the tube, which causes difficulty in passage of the ovum and hence cause infertility. Now we come to the uterine causes of infertility. Now in uterus, there can be a big fibroid in the uterus which can take up a lot of space and can cause problems in implantation. Apart from that, there can be uterine hypoplasia, mostly endometrial hypoplasia. Then there can be endometritis, right? Now due to certain uterine problems, there can be formation of uterine synecdoche formation, as in case of Asherman syndrome or uterine TB, etc. Now there can be congenital problems in the uterus, like there's a septum in the uterus or something which causes problem with implantation or growth of the baby. That is congenital malformation of uterus. Or it can be that there is inadequate secretory endometrium. That means the endometrium doesn't have enough glands. That is inadequate secretory endometrium, right? So these are more or less the causes of uterine causes of infertility. Now we come down to the cervix. So in cervix, you can have something known as the cervical polyp, right? Now there can be something known as cervicitis, or there can be something known as the elongation of cervix, or it may so happen that the cervical mucus is unduly thick, that is thick cervical mucus, right? These are the cervical causes of infertility. Now we come down to vagina. Now in vagina, there can be atresia of the vagina. Okay, so there can be atresia, vaginal atresia, or there can be narrowing of vagina, narrow vagina, which causes problem in copulation, or there can be certain septums in the vagina, transverse vaginal septum. So more or less, these are the local causes of infertility in a female. To summarize, anovulation or oligovulation, decreased ovarian reserve, trapped ovum, and luteal phase defect are the ovarian causes of female infertility. Now, adhesions, tubal surgeries, salpingitis, retained mucus debris, tubal spasm, and tubal polyp, these are the fallopian tube or tubal causes of infertility in females. Then fibroid uterus, uterine hypoplasia, endometritis, inadequate secretory endometrium, uterine congenital malformation, uterine synecdoche. These are all uterine causes of female infertility. Finally, cervical polyp, cervicitis, thickened cervical mucus, elongation of cervix. These are the cervical causes of female infertility. And transverse vaginal septum, atresia, and narrowing of vagina. These are the vaginal causes of female infertility. And the systemic causes that we are talking about, that may include age, anxiety apprehension, there can be immunological factors, thyroid disorders, etc. We will talk about those things in a separate video.